Hello everyone, once again welcome back to our YouTube channel. Today we are going to talk about drug in pregnancy and lactation. So first of all, why we are studying this topic? Because as we know, in pregnancy, before prescribing the drug, we have to know this drug is teratogenic or non-teratogenic. So first of all, what is the meaning of teratogenic? Teratogenic. So first of all, teratogenic drugs are those drugs which harm the baby, or you can say product of conception, or you can say fetus. Okay, so these drugs are contraindicated in pregnancy. So for that, we have to know what are those drugs. So ultimately, by this you can understand one thing, that the teratogenic drug, any drug to produce the teratogenic effect or to harm the baby, that drug should cross the placenta. So first thing, approximately, or you can say almost all drug, like almost all drug, not all, almost all drug can cross the placenta. So it means, it doesn't mean that we can't give these drugs, but all drug are not teratogenic drug because they are not harmful for baby. Okay, so they will not harm the baby. So it means we should not give those drugs which can cross the placenta, but they have teratogenic effect on baby or product of conception or fetus. So first point which you should remember, those drugs which can't cross the placenta, it means those drugs we can give in pregnancy. So heparin and insulin. These drugs can't cross the placenta. So it means we can give these drugs in pregnancy. For example, any female have diabetes, we can prescribe insulin, like type 1 diabetes. So now let's try to understand one thing. In pregnancy, we divide pregnancy in mainly 3 trimesters. Yeah, everybody know 3 trimesters. So first, second and third. So you have to understand here that in first trimester, organogenesis occur. Now, what is the meaning of organogenesis? So organogenesis means formation of organ. So in first trimester, organogenesis is going on. Okay, and what is the meaning of organogenesis? Formation of organs like brain, heart, small intestine. These are organs. Okay, lungs, liver. Now, if mother will get contact during her first trimester, and that is teratogenic drug. Okay, so if we give teratogenic drug in first trimester, ultimately it will affect the process of organogenesis, or you can say process of formation of organ, and we can see gross malformation of baby. So now you can understand, for example, if formation of organ is disturbed, and the outcome is that organ will not form. For example, brain is not formed. What we called it anencephaly. Yeah. For example, if eye is absent in baby, we can say anophthalmia. Yeah, by this. And now if you want to understand, like if on which trimester, what is the effect of teratogenic drug individually on first, second and third trimester, so you can write down in comment. So here the main thing is, we can't give teratogenic drug during pregnancy because it can do malformation in baby. So why we are studying this topic? Because we want to know if any drug we know which is after prescribing which is going to do malformation, obviously we should not give, we will not give this drug. We will give only those drugs which is safe in pregnancy. So first of all, we read antihypertensive drug. For example, there is one female who have hypertension and we have to prescribe any drug. Or you can say that that female is already taking antihypertensive drug, but those drugs are teratogenic drug. So that lady can't continue those drugs in pregnancy. So first of all, what are those drugs which are contraindicated here? So drug like AC inhibitor and angiotensin receptor blocker. These drugs are teratogenic drugs. So these are contraindicated in pregnancy. So if these are contraindicated in pregnancy, what are those drugs which we can give? Drug like labetalol and methyl-dopa. These drugs are safe in pregnancy. So the drug labetalol, this is the drug of choice in pregnancy, in routine pregnancy and in emergency both. Labetalol is the drug of choice. So our first priority goes to labetalol. Okay. Now second, for example, you get one female which is going on antithyroid drug. Okay. So the female have thyrotoxicosis, or you can say grave disease. So that female is taking antithyroid drug. So what are those drugs which is safe? Like what are those antithyroid drugs which are safe in pregnancy? So first of all, PTU, it means propyl thiouracil. And antithyroid drug we also have carbimazole. We have these two drugs. Okay. Now this drug can cross the placenta. And this drug also can cross the placenta. So which drug we should give? So only that drug which we should give in first trimester, which can cross lesser compared to another drug. So you can say here the PTU drug, it cross the placenta lesser. It cross the placenta lesser compared to carbimazole. So in first trimester, we should give this drug, PTU, propyl thiouracil. But so you can say this is the drug of choice in first trimester. But after first trimester, we should give carbimazole. So if they will ask you drug of choice for second and third trimester, then carbimazole will be the answer. Now you can ask why we are changing the drug, why we should not give only propyl thiouracil during whole pregnancy. Yeah, but here you should understand one thing, that what are the disadvantages of propyl thiouracil. First of all, this need to give 3 times a day. So I am writing PTU disadvantage. So what are the disadvantages? It should give 3 times per day, and this drug can cause liver damage in female. Liver damage in female. That's why we are switching the drug. PTU we are giving only in first trimester, and after first trimester we are going to give carbimazole. Okay, so this is all about antithyroid drug. Then next we should talk about anti-epileptic drug in pregnancy. Anti-epileptic drug in pregnancy. So for anti-epileptic drug, you have to understand one thing. See, anti-epileptic drug. First thing you should understand that all anti-epileptic drugs are teratogenic. All are teratogenic. And you have to understand one more thing. Epilepsy is a special condition which we have to give more attention. So if all are teratogenic, which drug we should give? Simple. We should give that drug which are less teratogenic. So in this we can divide. There is less teratogenic, and another is, you can say, high teratogenic. So which drug have the highest teratogenicity? that is valproate. And which one is the least? That is lamotrigine. That is lamotrigine. So this is around, you can say, if you want to say in percentage, this is around 7 to 8%, this is around 2 to 3%. So but here we have to pay attention on one thing, that if this female got epilepsy during pregnancy or in pregnancy, then we are going to prescribe less teratogenic drug like lamotrigine and levetiracetam. But if female have, like if already any drug is going, so if already drug is going and it's effective, so after taking this drug, like patient don't got any seizure or there is no seizure occurrence, or like before pregnancy that lady is on one anti-epileptic drug and after taking this drug there is no seizure, so we should not change this drug even in pregnancy also. So for example, if any female before pregnancy is taking valproate drug, okay, which is highest teratogenic, so after she got pregnant, we are not going to change this drug. So what we will do to protect the baby or to protect the fetus or to protect the product of conception, we should add, or we should advise folic acid, or you can say we will add high dose of folic acid, and we will tell the patient that we will advise the patient that you will not miss the regular ultrasound. Okay, why? Because we can detect the malformation, and if is there any malformation, we can abort the child earlier. Okay, so for protection we are giving folic acid. So most of the anti-epileptic drug cause neural tube defect and folic acid prevent the neural tube defect. So most of the anti-epileptic drug causing neural tube defect, which prevented by folic acid. And what is the dose of, like normal dose in pregnancy, we should give around 400 microgram per day. Okay, but those female normally we give, but those female who have high risk, for example, female who is on epileptic drug, for these female we will increase the dose 10 times, or you can say 4000 microgram per day, or you can say 4 mg per day. So we increase the dose for these females. So I told you, if first time occur seizure in pregnancy, we can start the safest drug. But if already drug is going and it's effective, so we should not change the drug. What we will do, we will add the folic acid. Even though normally we will give in pregnancy folic acid, every female must take folic acid during pregnancy, but in this special condition we will increase the dose of folic acid. Okay, so next we will talk about drug for bipolar disorder in pregnancy. Drug for bipolar disorder in pregnancy. Okay, now, so normally, or you can say mania. So what is the drug of choice? Drug of choice is lithium for mania in pregnancy. But normally, no, I'm not telling you in pregnancy, normally drug of choice for bipolar disorder, lithium. But this lithium drug is teratogenic. Why is teratogenic? Because it can cause Epstein anomaly. Epstein's anomaly. And what is the meaning of Epstein anomaly? In this mainly you can understand there is a congenital tricuspid atresia. Tricuspid atresia. What is tricuspid? Tricuspid wall in heart. Okay. So what drug we should give in pregnancy? So we are going to give antipsychotic drug, but we can't give lithium. Okay, so which drug we should give? So we will give antipsychotic drug, and these drugs are drug of choice in bipolar disorder and safe in pregnancy. And these drugs mainly we divide into two, typical and atypical. So the typical one is drug of choice, and we should give in bipolar disorder because these drugs are safe in pregnancy. So next, let's talk about antimicrobial drug. For example, any female got infection, so we should prescribe the antimicrobial drug. Antimicrobial drug in pregnancy. So you have to understand mostly teratogenic drug. Antimicrobial drug are mostly which are teratogenic. It mainly, for example, we will talk about tetracycline. This drug affect growing teeth and bone of baby. Okay, and you have to know which antimicrobial drug which are safe in pregnancy. Mostly are teratogenic, but which drug which are safe in pregnancy. So safe in pregnancy, you can learn or you can remember this by mnemonic PCM. It's not, you can learn like PCM, physics, chemistry, math, or you can take like paracetamol. So P for penicillin, which is safe in pregnancy. C for cephalosporin, and M for macrolides. In macrolides, except tetracycline. And you have to understand like fluoroquinolone, these are also teratogenic drugs which mainly affect the cartilage and bone. And in malaria, you can say like sulfa drug also. Sulfa drug, they can also teratogenic, they can cause kernicterus. And the aminoglycoside drug are also. And in malaria, chloroquine, we should not prescribe in malaria during first trimester. We prescribe the quinine drug. So these are about antimalarial drug. Now let's talk about lactation. So in lactation, we should pay attention on those drugs. What happens? Like some drug secrete in milk, and when baby will feed, ultimately these drug can produce the effect on baby. Okay, so we should give milk baby such a time when the drug present minimum in the blood of the mother. When drug presents minimum in blood of mother. Okay, so you can tell the female that like you should take drug after feeding. First feed the child, and after feeding you can take the drug. So these are all about drug in pregnancy. Okay, bye bye guys.